Good morning. This is a re-recording of a Valley View University presentation we presented earlier this week. The title is "What is Wrong with My Veins?" We're going to be discussing venous disease. I'm Dr. Ethan Munzinger. I'm an interventional cardiologist at Valley View Hospital. My background is that I trained at the University of Missouri for medical school. I did my residency, internship, and general cardiology fellowship at the University of Oklahoma Health Science Center, and then did an interventional fellowship where I was trained on invasive procedures at the Detroit Medical Center. I was in practice for over 4 years in the Central Arkansas area, and am now full-time at Valley View Hospital in Glenwood Springs. We'll begin by discussing the difference between an artery and a vein. I get this question quite frequently. The blood vessels are different and they have a different structure, and as a result, the pathology or the problems that can develop are different. We'll also describe the difference between a deep vein and a superficial vein and the types of problems that can develop in each. And then we'll describe treatment options for deep and superficial vein problems. An artery is a thick-walled blood vessel. The wall is thicker than with a vein. These can develop cholesterol blockages or plaque that can result in stenosis or narrowing of the blood vessel. And this is commonly the culprit or the problem for developing a heart attack or myocardial infarction, or developing blockage in the artery of the neck leading to the brain called the carotid artery, which can narrow and result in stenosis. So this is the problem that can develop in an artery. A vein drains the deoxygenated blood back to the heart. And so the heart is a pump. It pumps this red oxygen-containing blood throughout the body, through the arteries. After the blood circulates through the capillaries, it coalesces into the veins, and then it returns to the heart. Obviously, there's no heart or pump in the feet, so the question is, how does the blood return to the heart? It does this through a low-pressure system in the veins, and there are a series of one-way valves. So as the blood travels up the vein, the valve closes, and it helps prevent backwards flow of blood and pressure. And this is the type of problem that can result in venous pathology, where the valve in the vein does not close properly. And so you have backwards pressure or flow called reflux, which we'll talk about. So I wanted to also, I've discussed this somewhat, but wanted to go through some of the pathology that can occur in arteries and veins. We talked about a cholesterol-rich blockage that can develop in an artery called a stenosis. Arteries can harden, we call this sclerosis. And then blood clots can occur in both arteries and veins. This is usually a medical emergency in both cases and requires prompt medical attention. A vein is a thin-walled structure, and it can dilate or stretch out, and that's called varicosity. And we see patients with varicose veins in their legs quite frequently. You can develop that backwards flow from a vein stretching out and the valve not closing properly, and that's called insufficiency. And then arteries and veins, when they develop pathology or problems, can result in wounds, particularly on the lower extremities. We can see ischemic wounds from arterial problems where there's inadequate blood flow through an artery into the lower extremity or the foot, for example. We can also see wounds that result from venous insufficiency, and that wound tends to look a little bit different, usually around the ankle. Sometimes, and for some patients, they have a problem with both the artery and the vein, and then we work through various testing to figure that out. We'll also discuss treatment for venous pathology, and as we discussed already, the treatment is different for an arterial blockage versus a vein insufficiency problem. There are two types of veins in the leg. There's a deep vein and a superficial vein. The deep vein is the main conduit that drains the blood back up through the venous system towards the heart. The superficial veins drain into the deep vein, and the pathology or the problem that can occur in these structures is different. So superficial veins pathology frequently results in varicose veins or other vein findings in the lower extremities, such as spider veins or telangiectasia or reticular veins, which we'll discuss. Both deep veins and superficial veins can develop blood clots or thrombosis. If a blood clot occurs in a deep vein of the leg, that places a patient at risk for developing a blood clot in the lung called pulmonary embolism, where a blood clot can migrate or move from the deep vein of the leg into the lungs, and that can result in a significant problem for a patient and either require a blood thinner, or sometimes the blood clot needs to be removed. And that is evaluated on a case-by-case basis, and we encourage patients to seek care in the ER if they have symptoms of a pulmonary embolism. Blood clots can occur in the deep veins of the legs, and that can result in pain and swelling, redness, warmth, and discomfort in the leg. And the test for that is usually an ultrasound to diagnose that. The superficial veins in the legs can also develop blood clots. That is usually less of a medical emergency, and that can frequently be treated with warm compresses, non-steroidal anti-inflammatories such as ibuprofen. And on occasion, a patient may require a blood thinner, but that's less common than with deep vein thrombosis. We are now able to remove blood clots from the deep veins in the legs. So in this case, this picture here, the X-ray on the left is of a blood clot in the iliac vein. And this resulted in significant pain and swelling for this patient. And we were able to go in and use a vacuum tube to remove that blood clot. We then placed a video camera into the vein called intravascular ultrasound, and we were able to evaluate the vein to determine that it was no longer a nice circular tube, but rather a flat pancake. And that compression in the vein had contributed to this patient developing a blood clot in the vein. We were able to place a hollow metal tube or a stent into the vein to open it up and improve flow. I frequently, describe this to patients as if you were to go to the hardware store and buy a PVC pipe, you would not buy a PVC pipe that had been crushed flat like a pancake. You would buy a PVC pipe that was a nice circular tube. And the reason is that the flow is better through that circular tube than a crushed flat pancake. So sometimes, particularly in the left leg, the vein can be collapsed or compressed by an overlying structure such as an artery, and that's May-Thurner syndrome. And that's evaluated and treated in the way I just mentioned. Regarding stents in the vein, there are newer stents on the market which are designed to help expand the vein and prevent it from collapsing. And you can see here this horseshoe-shaped stent at the top right. Is a hollow metal tube that's flexible and designed to be placed in the vein. This is all done through a minimally invasive approach through a very small hole, about the size of the inner lining of a ballpoint pen, for example. And this helps improve flow through the vein, as we mentioned. In medicine, we like to talk about the severity of a problem, and there's a spectrum of disease severity for many different conditions. In the case of venous disease, we begin with C1, or the least severe stage, and this is usually patients who have developed spider veins on their legs. C2 is a class where a patient has developed varicose veins, and that's usually the result of a problem with the superficial veins, as we discussed already. In the third stage, patients can develop swelling and edema in the legs, ankles, and feet. And then the fourth stage, patients can develop skin changes such as thickening of the skin or discoloration. And in the most severe manifestation, vein disease can result in an ulcer or a wound at the ankle, as we can see on the far right of the screen. This is the most severe manifestation of vein pathology. Symptoms of vein disease, there's a large spectrum of symptoms. Some patients describe burning, itching, heaviness, aching, or discomfort. Patients describe swelling or a sensation of fullness. I frequently have patients say, when I wake up, first thing in the morning, my legs are elevated in bed. I don't have any swelling. As soon as I get out of bed and go about my day, I begin to feel a fullness in my leg or a sloshing sensation or swelling in my legs, and that can be a hallmark of a vein problem. We already discussed skin changes. Patients can develop discoloration or eczema, flaking of the skin, a hardening of the skin, and that can be a hallmark of vein pathology. The symptoms tend to progress over time. We don't see children running around playgrounds with varicose veins in their legs, but we do frequently see patients develop varicose veins in the fourth, fifth, sixth, seventh decade of life. And it tends to progress over time. It may have started off as a small varicose vein, and over the course of months to years progresses to a larger or more symptomatic varicose vein. How do we diagnose this problem? We do a clinical exam, and then we begin with non-invasive testing that does not involve any X-ray. This is a simple ultrasound test that is not associated with risks such as with CAT scan or CAT scan dye. This is the very first step, and it gives us a good idea of what's wrong with the vein. We have some excellent vascular techs here at Valley View Hospital who do an exceptionally good job at evaluating the veins of the legs. And this is a typical illustration that they provide me, in which they have mapped out the veins of the lower extremities. They've described the diameter or the size of the vein. They've looked for backwards flow in the vein. And this allows us to develop a treatment plan for a given patient. The mainstay of treatment, we always begin with compression therapy. That's to help tighten that pressure around the vein to get that blood moving back up the leg. We encourage mobility, increased exercise, such as regular walking, calf exercises, and then elevating the legs. And some patients do fine with non-invasive treatment. Patients who need or desire invasive treatment, there are multiple ways to treat vein problems now through a minimally invasive approach. Again, all of this is done through a small tube called a catheter that's placed inside the vein. The days of large vein stripping are largely gone, and most everything is done now through small incisions or small tubes that are placed into the vein. It's an outpatient procedure, and the patient's able to go home within a few hours. The way that we treat the vein is we identify the problem vein that has the reflux and the vein is dilated in size. And then we aim to close down that problematic vein so that the body routes blood flow through healthier veins. The way that we close down the problematic vein is through radiofrequency ablation, use of a sclerosing foam that causes the vein to scar down, use of a surgical grade adhesive such as VenaSeal glue that causes the vein to shut down, and then occasionally use of a small laser as well. This is what we've discussed already, that the goal is to reroute flow through healthier veins and to basically take the problematic vein out of commission. It's a minimally invasive treatment. It's done on an outpatient basis, and patients return home within a few hours. With up-to-date techniques, this is more than 90% effective. And we frequently see that the swelling and the varicose veins begin to improve over the subsequent weeks. After treatment, oftentimes patients will be in compression for a period of days. This is just a compression sock or a compression wrap that we apply. Patients are up and walking the same day, but we generally have them avoid strenuous activity such as weightlifting or vigorous aerobic activity for a couple of weeks. If there's any bruising or inflammation, this can often be treated with ibuprofen or Tylenol or an ice pack. The risk of deep vein thrombosis or pulmonary embolism is quite low, no greater than 1%. And then everyone receives an ultrasound test after a vein closure procedure to ensure that there is no DVT or deep vein thrombosis. We also use an ultrasound scan at the time of the procedure to ensure that there's no deep vein thrombosis at that time. I do also advise patients that frequently there will be multiple veins in a leg or multiple veins between both legs that require treatment. This usually requires a follow-up treatment, and oftentimes we are unable to accomplish treatment of all of the veins in the same setting. So in summary, arteries and veins are different, and because of this, they develop different types of pathology or disease. The deep veins can develop blood clots, which can result in swelling, skin color changes, and wounds. Superficial veins can also develop blood clots, which can result in swelling, skin changes, and wounds or sores in the ankle that we discussed. And the treatment for these problems is different. Again, we would never close down a deep vein. The problem with the deep vein is usually a blood clot or compression, where the vein is becoming flattened, and that is treated by removing the blood clot and evaluating the vein for a stent to improve the blood flow in the vein. In the case of the superficial veins, the pathology there is often that the vein has stretched out and that there is backwards flow or pressure in the vein when a patient is standing, and that can result in swelling and varicose veins. And the treatment there is to close down the vein with the techniques we discussed. It's an effective treatment, it's minimally invasive, and it's done on an outpatient basis. I want to thank you for watching this Valley View University, and please don't hesitate to contact us if you have any questions or would like a further evaluation of vein disease. We have clinics throughout the western slope of Colorado, and we're accepting new patients and happy to see patients for a second opinion. Thank you so much.